Hello. I'll be walking you through fungi chemotherapy. When you talk about fungi, they are basically eukaryotic in nature, meaning that they have a well-defined cell membrane, right? So they have cell wall, they have the cell membrane, and then the intracellular contents. There you have what we call the nucleus, the cytoplasm, the endoplasmic reticulum, the Golgi apparatus, the vacuole, cytoskeleton, a whole lot of them, right? So let's go over to the cell wall. The cell wall is essentially made up of what we call the chitin, and then we have the beta glucans. Beta glucans can be 1,3 beta glucans and 1,6 beta glucans. Then we have the manoproteins and then the melanin in some fungi. And then we go over to the cell membrane. The cell membrane essentially, of course, they are in layers, just like the cell wall, where you have your squalene, you have the lanosterol, and then you have the costerol, right? Of course, I've mentioned the intracellular content. So if you want to be diabolical and you want to destroy this fungi, you can either target the cell wall or target the cell membrane or target the intracellular content of the cell. So let's talk about the cell wall. There are medications that are essentially designed to target the cell wall of a fungi, right? They are called the polyenes. And examples of the polyenes are essentially amphotericin B, your nystatin, and then you have what we call what's the name do we have? Nystatin, amphotericin B, natamycin. Not a very common name, but we can use natamycin to destroy the cell wall, of a fungi. So what they do basically is to bind to the ergosterol, and then they will lead to the destruction of the ergosterol. They will subsequently lead to leakage of the intracellular content of the cell, and then the cell would die, the fungi would die. So that's essentially how they work. Polyenes, amphotericin B, nystatin, natamycin, they are basically examples of polyenes, and they target the cell wall of the fungus, right? So let's go to the cell membrane. The cell membrane essentially, of course, like I said, constitutes what we call the squalene. The synthesis of the squalene will lead to the formation of what lanosterol, and then synthesis of lanosterol will lead to formations of what ergosterol. So for squalene, for lanosterol to be formed, there will be a synthesis of what? The squalene. And this synthesis is facilitated by an enzyme called the squalene epoxidase. Now, if you want to stop the lanosterol from being formed, you can inhibit the squalene epoxidase. And there are drugs specifically designed to inhibit squalene epoxidase. They are called Allyamines. Example of the Allyamines are the terbinafine. You can use the naftifine and a whole lot of that. So what they do is to stop lanosterol formation by inhibiting the squalene epoxidase. Of course, you can stop the formation of what? Ergosterol by inhibiting that enzyme that facilitates the conversion of a lanosterol to ergosterol, called the lanosterol 14-alpha demethylase. Once the enzyme is inhibited, there will be no formation of ergosterol. Of course, there are drugs designed specifically to inhibit, that enzymes, and those drugs are called azoles. Azoles can be imidazoles, they can be triazoles. Example of imidazoles, they are the ketoconazole. I think we have ketoconazole here. The ketoconazole is an example of the imidazoles. You have the miconazoles. You have the clotrimazole. This is a clotrimazole. So they are examples of what? Imidazoles. And then when we go into fluconazoles, of course they do the same thing. They inhibit lanosterol 14-alpha demethylase, that will lead to the blockage of what? Ergosterol formation. So examples of triazoles are the fluconazoles. I don't know if we have any fluconazoles here. We have itraconazoles, we have the posaconazoles, we have the voriconazoles. They are actually, triazoles that are designed to inhibit lanosterol 14-alpha demethylase. So we've talked about the cell wall using your polyenes. We've talked about the cell membrane using the Allyamines and then the azoles. Now, assuming you want to go deeper into your diabolical activities, you want to destroy the cell, the nucleus of the cell. So you can use what we call the pyrimidine analogues. The flucytosine basically inhibits the DNA RNA synthesis. You can use flucytosine, is a pyrimidine analog. You can stop the mitotic formations, mitotic spindle formations in the nucleus of the cell. That's you can stop it by using your chrysophovin. Chrysophovin essentially stops the mitotic spindle formations and um, and a whole lot of that. So we've talked about fungal chemotherapy essentially in brief, that you can destroy the cell wall, you can destroy the cell membrane, you can equally go into destruction of the 1,3-beta glucans. 1,3-beta glucans, they are like a scat food, essentially a scat food upon which the cell wall is built. So you can use echinocandins, example, your caspofungins, your micafungins. What they do is to destroy that 1,3-beta glucan, the scat food upon which the cell wall is formed. So essentially, these are some of the drugs we can use to destroy fungi, right? So today we've talked about what? Fungi chemotherapy. Thank you.